Okay, this is a new super pubic catheter change. So it's the first one since he's had a new one. So we're going to figure this out, aren't we, Ben? Making sure that everything works. Get all the equipment's ready prior to this. I just got to put some sterilised gloves on and just really try and just get on with it and see what it's been like. So, before we start, how have you felt for the last shit? That's okay, it's only the syringe. 10 weeks. So he's just having spasms at the moment because he's bypassing, believe it or not, today. Oh. It was due tomorrow. How have you been for 12 weeks? Good. Shit me back. Right? So I'd say now that Ben, I can't wait to get this changed. I have prepped all the area. And this mask is making sure there's no blowback on me and no spit going inside at the same time. So I'm just waiting for Ben to breathe so I can get on with this. Once he does that, everything's ready like I said. I'll just get his catheter ready. And that syringe that just fell down there, it's in a sealed packet. So everything's sealed. And at the moment, I'm not touching that in there. So I can do everything from here. And just make sure you keep all those batch numbers, reference numbers. If your catheter goes wrong, then we can't give over those numbers. How are you feeling, Ben? So, like, with this, so it will just be, because it doesn't matter, everything's sterilised in Ben's room, so this can go right here where I've got the other syringes. And I'll just open up everything and then we can get on with it. In the meantime, I haven't done a blood pressure. So this one here is the glycerine. So this is what goes inside with that balloon inside, and that is what keeps it in situ, should, for 10 weeks, 12 weeks, sometimes up to. However, with Ben, it's failed the day before, which is fine. So this is going to be the anaesthetic that we use in, which is, I'd rather not say, because each time I open my mouth, I get a bit of a bollocking. So I'm going to get myself some sterilised gloves on and hopefully just get on with it. Just do that now. How are you feeling, Ben? Are you ready for this? Because this is the first one, obviously, and I haven't done this myself.
I'm ready now.
You? Well, no, you are, but I'm just saying, are you ready for this? I'll do double gloves, so I've got no messing about. Typical, it happened on a Saturday. We didn't expect that one. So I've got my Sarilon, I've got everything here. We don't need this pot as yet because there's a spigot on the end of the catheter. So that's segregated. Just all you've got to do is go all the way down and put that on your sterilised pack, which goes all the way to the bottom. My bag's to my right. I work from right, left, right, left, right. Right, and how's Mr. Benjamin?
All right.
Okay. So here's my syringe. So you're gonna, I've got it. He's got to breathe at the same time. Otherwise, I'm gonna have like real bad complications with him on my own, just because of he can be a bit complicated with the breathing at the same time and the spasms. So what I've noticed with this, the last week, I'm gonna say, is the colour. The actual colour, oh yeah, I'm talking about colour. I'm going to go, oh, this is cool. But I'm sure this is the right colour it would go anyway, because it's obviously the glycerine that's inside. And the right, it doesn't escape. So I put 6% in. It looks like 7 at the moment, so let's just do it from there. So 6%'s coming out. So that means that that stayed in situ. just gone a different colour.
Oh,
See the difference? Yeah. See the difference with the colour?
Mad.
Yeah. Well, so that has stayed in situ in his bladder for 10 weeks, that's pretty cool, to be fair. So remember, all this is sterile. My hands I've kept. I've not touched anything. I'm going to whack that out with a dirty glove, I call it.
It's not water, is it? No.
And then I'll just use that to go straight back inside. Are you ready for this?
Yes.
So what I'm going to do...
Put out.
Yeah, I know, I'm ready for this. I'm going to use a little bit of gauze, right? So over the top there, just in case I do get any leakage. So I'm going to lift up, get Ben, obviously, to keep breathing. So his legs just go... I can't touch nothing at the moment. Well, I can, because it's called my dirty hand. So I'm going to open up the side and hopefully just pull on the catheter. Take a breath. Take a breath. Remember, this is my first time on my first one, not my first time doing catheters. First time doing this one.
Hang on.
It's okay. You all right? So it is a bit mucky as usual around the balloon, where the balloon area is, but one thing it isn't blocked. So that's a good sign. It's not non-blockage. If I could show you with that syringe that we've just took out, I'll show you that balloon if I can. How you feeling?
That was good, actually.
It came straight out, didn't it?
Might too bad, love.
So if I put the pre-fill back in there, watch. So you see the brownie bits? That's just normal. It's just where it would sit it like there in the bladder. So it's kind of like, that's pretty cool. I'm pretty, and there's no smell to that either. So I'm happy for that, actually, which is brilliant. I am ready. I'll just gonna don the gloves off and get you straight in with the catheter with this hand straight away, even though, because these are the only two fingers I need. I don't need anything else. So the first thing that's going in is, oops. So all you've got to remember is when you're looking at your pre-fills, is what. Don't get mixed up with what's what, because the glycerine is completely different to the anaesthetic. So I'm only going to put 6 mils actually inside. So again, I'm going to hold his leg for this. I'm going to lift up. There will be a bit of blood. I'll have to remove the blood first, and there's a bit of a clot there, so I'll just remove the clot. Don't want to be pushing any clots back in. And then that goes in. I'll wait first. Are you all right?
Put it in.
Yeah. So now I'm going to go about 6. So yes, you do get blood. And hopefully that bladder spasm will go in a minute.
It will now.
That normally last time on that first catheter change, on this kind of catheter change that we did, it went. I've got to wait for the legs to just stop. I cannot get a catheter in there just yet. Are you okay?
Yeah.
It's all right. What I did do was I left my other gloves over here, like a nerd. So I'll don them off and get a new pair of gloves on.
Well,
and how you feeling? So to be fair, this catheter change has been really, really easy. There's nothing wrong with Ben. His breathing's fine. Hold that close up, never does. Talking about the stoma hole, we've left Ben's out for 15 minutes before now, and it's never closed. However, it is 26 years, so you do have to sort of
hurry up.
No, lots of people say hurry up, but you don't have to hurry like they think. So, this now. Where did I put that thing? And then that's gone in there. Let me move that bag out the way. Pardon?
What are you doing now?
Well, I have to use, you see the rest of this? So, the rest that's on that now is I will use for,
The balloon.
The balloon. I don't use all of it. So what I'll do is I'll pull my tray. This is the catheter with the tip. It's beautiful because it's got two from there in the sides. And then you've got, sorry, these are really wobbly, but, and then you've got an open tip at the bottom. So you'll just grab as much lube as possible, just so, and it's got a spigot at the end, so we don't have to worry like last time. It's great. So my finger is roughly as far as how it's going to go in. I can't touch because this is my actual sterilised hand. So hopefully now Ben won't spasm. Once the spasm's gone, I'll be able to complete my task. And I'll lift the belly up, right up. I'll take that clot like... So this is obviously the first time, the second change of this one. And you do have to wiggle around a little bit. I'm waiting for him to stop spasming.
I have stopped spasming.
No, you haven't. You've gone tight. So he's clamped inside at the moment. So until his inside is relaxed, even though he says he stopped spasming, which is fine, I need to get the catheter actually in place, in situ. That's it. Oh, no, it's come out. There's a first. It's never come out before, so I've had to push that quite quickly in because obviously Ben's...
Hole's closing up.
No, his hole's not closing up.
I bet you it was.
I'm going to tell you and everybody the hole was not closing up.
Oh, I thought that it was.
No, I'm holding onto it. I don't know whether you can see. This is the slowest catheter change I've ever done for a long, long time. However, it's because of all the... it's because, one, it's new. Two, he's having a lot of spasms because we're having acupuncture and it's having a bit of an effect. And three, he's had clots with this. So it's twice we've had, unless he's pulling the old clot out, old clot in, but there is a bit of blood. There is a lot of clots. So what I'll do now is I'll get and sort the clots out.
Is it done then?
And blow the balloon up. So what I need to do is just go and repeat my gloves.
I had no idea, you know.
None at all.
Just hot sweats.
So this is why you should double glove. I mean, I have double glove, double glove, double glove. I'm sick of gloving up, but this time I can't double glove because I've gone stupidly and had my nails done knowing that I was doing a catheter change.
Oh.
And I'm the only caregiver to Ben that does this, so there's no district nurses, there's no doctors, no nothing, nobody else. We have to do it ourselves. So how you know that is in situ, in place, is show you in a second when we've got those spasms gone completely, because it's a nightmare otherwise. Let me just move out that pack, move out the stuff from there, and then what I've got is, this is the pre-filled, no, yes it is, sorry, that's the pre-filled syringe that's got obviously the glycerine now in, that's going to be staying in situ. So for that is you'll pull that back and it can't go back any further. Let me just blow the balloon up and I'll show you. So I don't even have to hold that in place. And where there's a lot of people that go really slow with this, sometimes if you're in an emergency and you've got to get it in and release and get the urine out, blah, 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 you can go really, really quick. So it's pushing it in into the orange nozzle, capping off. And what's giving him AD is not that. So now I'll pull. So I'll show, I don't know whether you can see it on video there, but if I take a nice little tug there, there's no way that's coming out. Oh, even though I'm not. He says, oh God, because he thinks I'm killing him, but I'm not.
Not in AD.
And he's in AD for this pure simple reason is he's got a spigot on and I need to release.
Yeah, you do.
So once I've released that, his urine will be out in a minute. And So will a few clots, which is coming, which is great. Let me just I'll take my gloves off and I'll show you what happens if you don't get urine or if you get clots like this. This is normal. Let me just get some more gloves on. How you feeling?
Still OD.
Well, you will be. You've just had a catheter change.
No, but I had none a minute ago.
Well, you need to drink as well, though, Ben.
No, I think urine was come out though.
Well, there is urine coming out, mate.
How is that?
Yeah, urine's already started coming. So all I'm going to do is push this back into there and pop a new one on. And then, because Ben's having a shower, I would normally wipe all that down, but I don't need to. So I'll move that way, move the spigot, move everything, so there's nothing dirty there. And Ben then needs to have a good old drink, and we're going to get him up. But I'll just show you what is coming out, what's normal. And that catheter change was absolutely perfect.
Brilliant.
And for that catheter to stay in the way it stayed in,
Brilliant.
Is absolutely amazing.
Awesome, love.
The clots are, at least the anaesthetic's working, so I can work along getting the clots out from around the point of the stoma, because I don't like them around there for him, especially when he's just about to get in the shower. So I get rid of that, and then
it's done, love.
Feel that the catheter's warm, but it can take up to 10 minutes. Always think about that. Always remember that. And always make sure that the person has a drink. And if you've got any smells or any redness around the actual stoma, you know that is an underlying infection. Getting district nurses in. But as far as we're always going, we're all right. And my really to be fair. And this looks peachy. I'll just show you what we've got, because obviously that's what I'm working with.
No problems, sir.
Pardon?
No problems.
So we've had no problems. This is as much kit as I have to get ready, and then this is what comes out. So obviously this is the end product, and by the time that flashes through in about 5 minutes, a couple of minutes, Ben will be in the shower and it'll be done.